everyone. Welcome to today's Pet Podcast. Thank you for joining us today. I'm your host, Dr. Roberta Westbrook, and we're here at the Campus for All Animals, the Houston SPCA. So once again, we have some information for you, just a few little helpful tidbits about understanding your pet's respiratory tract and common respiratory diseases that might affect your pets. So we've got lots of information for you. If you have questions about respiratory diseases that affect your pets, please write those down, get them in the chat, and hopefully I can help you today. In the meantime, I still want to continue to introduce you to all the wonderful pets that we have available for adoption. This week's Pet of the Week is named Heru. Heru is a wonderful dog. He's about 1 year old. He's a male. He's neutered, and he's very active, very playful. He loves to get treats, very food motivated, which is very helpful if you want to teach him new tricks. He loves to give kisses. And of course, he loves to show you his bowing skills. He loves to play and bow down on his front legs. So he's really adorable. He'll make someone a wonderful family pet, very active. So if you've got an active lifestyle, maybe you've got some goals about getting out there and exercising or doing some hiking, I think Heru would make a great pet for you. But come on down to our adoption center. We're open every day from 11 a.m. to 6 p.m. There's no appointment necessary. You're free to come on down and look at all of our adoptable pets and consider who you want to make part of your forever home. So yes, let's get started talking about respiratory disease in pets because it's very common and there's lots of different diseases that can affect our pets and their respiratory tract. And so we'll just get started talking about some of the basics. Many of you are probably wondering like how a pet's respiratory tract might be different from a human respiratory tract. And honestly, they're very similar. They're very similar. We have all the same parts. But because dogs come in such a variety and animals in general come in such a variety of shapes and sizes, that's typically the major difference is the size and shape of the respiratory tract. But we've all got the same parts and they do the same job within the various species. So what other questions do you have out there that I can help you with?
So can you just generally, go over what the respiratory tract is of a pet? Do like the trachea? We've heard that word a lot.
Yes, in general, you guys know the respiratory tract is responsible for taking in oxygen, oxygenating our blood. That oxygenated blood gets carried to all the organs in the body. And then this is what happens. As you breathe in and you take in oxygen, this happens in our pets too, the blood that is flowing through the lungs takes in that oxygen. And all of the oxygen molecules that we just breathed in, it gets absorbed by the bloodstream. Then the bloodstream pumps that oxygenated blood to the rest of the body, to our limbs and to our head and our brain and our heart. And so that oxygenated blood helps to keep us alive. As that blood delivers oxygenated blood to the body, it also gets rid of carbon dioxide. So as our body receives oxygen, there's an exchange through the blood where the blood receives oxygen and then pumps out carbon dioxide into our respiratory tract. And that's when we breathe out carbon dioxide. So there's an oxygen and carbon dioxide exchange. So our respiratory tract is very, very important, again, in getting oxygen into our lungs. There's an exchange of oxygen for carbon dioxide in the lungs, and then our lungs breathe out the carbon dioxide. So that is the most important function. But the parts of the respiratory tract are essentially the same. I mean, we've got the open mouth, and then the air comes in through a windpipe. Most of you guys know the windpipe. You know that is the tube that brings air into the lungs. In medicine, we call that the trachea. So the trachea is the windpipe. It is a tube that has some cartilage rings in it that keeps it open. That's how air gets into the lungs. Then we have lungs. We have both right and left lungs. And depending on the species of animal, it depends on how many lobes to the lungs there are. So we have our lungs, and those are the main parts of the respiratory tract. Obviously, again, the blood is important because it helps to transmit that oxygen and carbon dioxide.
And is it true that dogs use their tongues to breathe, or where did that myth come from?
Yeah, so what we mean by that is when dogs are panting, it really helps to cool them down. So they use panting as a cooling down surface. But again, remember there's blood flowing through all of the tissues. And so as they pant, it's allowing them to take in more oxygen, which allows for more oxygen and carbon dioxide exchange. And so it helps to keep them well oxygenated and to get rid of carbon dioxide that's built up. And so it certainly does have a function in helping to get more oxygen into the body.
And speaking of tongues, why do cats have rough tongues and not dogs?
Oh yeah, so cats have these nice little, kind of cartilaginous spikes on their tongues that makes it feel a little rough when they groom you, kind of like sandpaper. And yes, so that helps them to groom themselves, and it helps in the stimulation process when they're mating. And so yes, has lots of functions, but cats have those little spikes on their tongues to help them for grooming processes.
And someone asked that their poodle, a miniature poodle, recently got diagnosed with collapsed trachea. What is it? What caused it? Or what are the treatments for it?
Oh yes, a collapsed trachea. So when you hear that term, you might be panicked by that. A collapsed trachea, that's your windpipe. And it's just like it sounds. You don't want the windpipe to collapse because you want air to get through. Well, it's not that the windpipe completely collapses. But what winds up happening is there is a membrane, a thin piece of tissue at the top of the trachea. And in some animals, that membrane is sagging, and it sags into the middle of the trachea. So if you can imagine, that my hands are creating a tube, and at the top of this tube, there's a little membrane that sags down. What winds up happening is as that membrane sags down, air cannot pass freely. And so animals that have a collapsing trachea oftentimes have noisy breathing, and sometimes they will cough when they get excited. And they're coughing because, again, that membrane is sagging down in the middle of the trachea. It's not allowing air to pass, and so it triggers them to cough. It can be mild in some breeds. It's more common in small breed dogs like miniature poodles. It can happen in Chihuahuas. So it's more common in small breed dogs. And it can be very mild to where there's no treatment necessary, and it only happens every now and then. And then some animals can be very severe where they require surgery. And in that surgery, what winds up happening is we put a stent in to open up the trachea and keep that membrane from sagging down. So collapsing trachea, more common in small breed dogs, miniature poodles, Chihuahuas, can be mild where there's no treatment, but could also be pretty severe where it requires surgical intervention.
And for dogs that are more susceptible to this, is it better to use a harness? Like, would a collar damage it more?
Sure. Anything that triggers the trachea, especially physically or in terms of an irritant, it can trigger that cough. So yes, if you have any patient that has a respiratory disease, particularly if it's the upper airway, like the trachea, a harness like we have here that fits them appropriately might be a good idea, so that as they're walking, that collar is not being pulled by the leash, and it's not putting pressure on the trachea, but rather the harness is going to be in a wider surface area around the chest. So that's actually a good idea.
And I've heard, those with that collapsed trachea or something similar have this weird like hacking sound. But we've also heard other types of hacking for dogs. How do you know it's collapsed trachea versus they have a cold or a cough?
Oh, yes, absolutely. So the veterinarians are going to help determine that. So don't feel pressure for you to determine it. You just take your pet to the veterinarian if they notice something. So yes, you might notice that sometimes the dog may sound like they have a cough where they're forcing out like like that is a forceful cough, and it's just like we sound. And then sometimes it sounds like this. And that is a different type of respiratory disease. That can be what we call like a reverse sneeze, where it sounds like more of a snort. And again, a reverse sneeze is just like it sounds like. It's more of a sucking in of air, and it can happen when there's an irritant in the back of the throat, or it can happen in some animals when they are, when they're excited. And so you have to, as veterinarians, determine whether it looks like the animal's forcing air out, which is more like a cough, or whether it looks like they're sucking air in or making more of a snort. And that can help us to determine where the problem is. Is it more upper airway or is it lower airway? But if you notice either of those in your pet, get them to the veterinarian, and they'll have a better idea by doing a physical exam.
And how, at the vet, how do you test for different types of coughing and diseases and things?
Yeah, that's a great question. So what do we do to determine it? Well, a lot of it is history. So when your veterinarian is asking you a lot of questions, it's not just to, waste time. That information helps us a lot. And so if you can also get the coughing episode on video, that helps as well too, so that we can determine the character of it. But history tells us a lot too, the age of the animal. So diseases happen usually in certain demographics of animals. So we want to know the age. We want to know, is this something that happened recently? Has it been going on a long time? Has it been gradual, or did it just happen very, very quickly? We also want to know how severe it is. Is your pet turning blue? Do they become lateral? Are they unable to, to be awake? All of these questions your veterinarian is going to ask, and that helps us to rule in or out certain diseases. So once we get a history, we'll do our physical exam, and ausculting the chest, taking our stethoscope and listening to the chest can really help us to determine whether we hear abnormal sounds in the chest. That can help. And then sometimes we have to take the next step in terms of testing, and that typically involves taking x-rays or radiographs of the chest, because then we can look at any of the lung tissue, the tissue, and we can determine some pathology quite easily with an x-ray. And certainly there are even more advanced testing modules aside from that, and that would be things like a CAT scan or an MRI or fluoroscopy. Those things are very advanced, and you may have to see a specialist if your veterinarian feels like they cannot diagnose your pet's problem in their hospital.
And what are the most common type of upper respiratory diseases that we see?
Yes, they're very common. So the one that most of you have probably heard about is in dogs. And in dogs, we call that kennel cough. So an upper respiratory infection is exactly like it sounds. It's an infection that happens, in the nose, in the trachea. Sometimes it affects the lower airways like the lungs. So, upper respiratory infection is a very general term. In dogs, we call respiratory infections kennel cough. And kennel cough, again, typically occurs in any aged dog. Usually it's a dog that's been around other dogs recently that you do or don't know. It's usually a disease that spreads in groups, and it usually causes a dry, hacking cough. Just a dry, hacking cough. It doesn't really typically sound moist, like there's a lot of phlegm buildup. So that dry, hacking cough in an otherwise healthy dog, typically the dog is still wagging its tail and eating and drinking fine. It just has this dry, hacking cough. We call that kennel cough. Some of you guys also know that as Bordetella. Bordetella is the bacteria that causes kennel cough. It's not the only one that causes kennel cough. It's just one type of bacteria that causes kennel cough. So when you go to the veterinarian and you get vaccinated against kennel cough, or you get vaccinated for Bordetella, that is what that is. It's the same disease entity, and it affects dogs. We do have a similar respiratory infection in cats. So cats can also cough and get Bordetella infections where they cough, but it's more likely that when cats have a respiratory infection, that they have a virus. And that virus is usually called a herpes virus, and it causes them usually not to cough, but more likely to cause sneezing, discharge from the eyes, and discharge from the nose. So in both cases, in dogs and cats, it's a respiratory infection. Typically in cats, it's caused by a virus. That virus is called a herpes virus, and you can get vaccinated. You can get a vaccination for your cat in that way. In dogs, it's called kennel cough, and it's more than likely caused by Bordetella or a few other types of bacteria. So in general, those are the most common respiratory infections we see in our pets, but there's lots of others as well.
And a question came in is, if a dog is fully vaccinated for the Bordetella, can they still get kennel cough at these places?
Yes. So the vaccine, unfortunately, is not 100% protective. None of our vaccines are. We cannot guarantee that even if your pet is vaccinated, that they're never going to contract Bordetella or some other type of respiratory virus. But certainly these symptoms will be milder and the course of the disease will be shorter. So it's overwhelmingly more beneficial to have that vaccine on board so that the symptoms will be milder and the course will be shorter, and they're less likely to spread it to another animal. So it's still worth getting that vaccination, and it's still required to board your dog at any boarding or grooming facility.
And Noreen on Facebook asked, what kind of natural remedies are available?
That's a a great question. We don't use a lot of natural remedies too often, but something that you can do to help reduce, especially if you have a dog or a cat that has congestion. That's a big thing, because when they're congested, they can't really breathe very well. Sometimes what we tell clients to do is, just like when you have a cold and you get in the shower and the steamy hot shower helps to open up your nasal passages, we oftentimes will recommend that for dogs and cats that have congestion. We say, go in the bathroom, close the door, turn on the hot shower, and let that warm air and steam not only moisten the nasal passages that prevents them from being dry and irritated, but it also can help open them up. It causes the blood vessels to kind of narrow and open up, and that can give them a little bit of temporary relief. So that would be one thing that I would recommend. It doesn't require medication, but can help your pets get a little bit of relief.
And what other treatment are available for kennel cough?
Yeah, so if your pet does have a bacterial infection, then your veterinarian will oftentimes choose to use an antibiotic. Now, kennel cough typically will go away on its own, even without treatment, sometimes in about 10 to 14 days. So it is not uncommon for veterinarians to just let it take its course, and typically dogs will recover. But in some cases, they may prescribe an antibiotic just to make sure that it doesn't continue to get worse, and to give the pet relief sooner. But it's typically a medication, an antibiotic, and sometimes they may also prescribe like a cough suppressant if the cough is consistent and really bothering your pet.
And somebody asked, how serious is canine distemper? We've heard about that sometimes.
Yes, so we're talking about common respiratory diseases. Canine distemper, which your pets are also vaccinated for regularly, is a more severe disease of the respiratory tract in dogs. And it's caused by a virus. The name of that virus is distemper virus. And what it does is it just causes a more severe disease. So it can cause pneumonia, but distemper can also affect the nervous system, the central nervous system. And so distemper can also lead to things like seizures and muscle twitches in the body. And ultimately, canine distemper can lead to death. Canine distemper has between a 50% to 80%, some texts may say up to 90% mortality rate. So it is not a disease that is curable. Some dogs will survive, so it's not impossible for a dog to survive, but it can be a very long road, and they can have a lot of severe effects from distemper. It's usually pneumonia, coughing, weight loss. Sometimes they have vomiting and diarrhea with canine distemper. Even though it's a respiratory disease, sometimes it can cause vomiting and diarrhea, and sometimes it can cause seizures and other central nervous system disorders. So again, if you're getting your pet vaccinated regularly, your dog vaccinated regularly, he or she is getting vaccinated against distemper. It's one of the core vaccines that we recommend. So if you're looking at your pet's medical records and you see something that says DAPP or DA2PP, or you see some acronym like that for your vaccines, that D is for canine distemper, so they're getting that vaccine. And if they're adults, they're much, much less likely to get that.
And you mentioned pneumonia. Is that something that dogs actually get?
Repeat the name of that.
For pneumonia.
Oh, yes, the pneumonia. So yes, when you see pneumonia, that's something that people get, but animals can get pneumonia as well. Pneumonia is an infection in the lungs, and it can be caused by a virus or it can be caused by bacteria, but it causes a lot of buildup in the lungs of phlegm, of bacterial exudate, and essentially the spaces in the lungs that should be filled with air are filled with bacteria and pus and unhealthy things. So pneumonia unfortunately prevents your pet from being able to fill his or her lungs with air. And if they're not able to breathe well, then they start to breathe very shallowly. They tend to cough. And if that is not cured and it goes on long enough, pneumonia can be fatal because you need oxygen. And so if the lungs are not able to become oxygenated, if the air sacs in the lungs are not able to be filled with oxygen because they're filled with pus and bacteria and viral exudate, then unfortunately sometimes that can lead to death. So if you're noticing coughing or difficulty breathing in your pet, please get them to a veterinarian right away. We diagnose pneumonia on an x-ray, on a chest x-ray.
So obviously we've learned our pet's respiratory system is very similar to ours. So just like pneumonia, can they get asthma too?
Oh, that's a great question, asthma. So yes, pets can get asthma. It's more common in dogs than cats, but they absolutely can get asthma. The most common thing that will cause asthma in a pet cat is typically things in the environment like smoke. So if there's a pet owner who smokes in the home, that secondary smoke that the cat inhales can certainly lead to asthma and cause difficulty breathing and coughing as well. And so it's a great idea to keep your pets away from any secondary smoke. It can cause inflammation in the lungs like bronchitis, like asthma, and in some more rare cases, it can certainly lead to lung cancer. So you do want to keep your pets away from any cigarette smoke. Well, thank you guys so much for joining us. There's so much more we could talk about in terms of respiratory disease in our pets. The list is really very long, but please just know that if you have trouble with your pet, you notice that there's something different about your pet, you know your pet better than anyone. And so when you notice that there's something wrong, don't hesitate to call your family veterinarian, get an appointment, and have your veterinarian do a physical exam so that we can catch any diseases as soon as possible and hopefully get them treatment and get them feeling better right away. So thank you so much for joining us as always here on the Pet Podcast. I appreciate your support, and the Houston SPCA appreciates you for being part of our extended family. So please go to our website, www.houstonspca.org, and consider becoming a volunteer or a foster or a financial donor and help us to continue to do what we do every day. So thank you again for joining us, and we will see you next week here on the Pet Podcast. Bye-bye.